So some of you have rightly and accurately pointed out to me that suddenly Florida's coronavirus cases have started to decline. California's coronavirus cases don't seem to be spiking the way the trajectory suggested. And I started to look into this, and indeed it is true. If you look at Florida, their cases have started to drop off, but it just so happens that Florida stopped testing. This is no conspiracy theory. This is what they announced they were going to do because of the hurricane. Hurricane Isaias, as Donald Trump has struggled to say. Look at this article from NPR from July 29th saying Florida will pause coronavirus testing due to impending storm. Now, it didn't happen all at once in all of the counties, so we are still seeing thousands of cases a day from Florida, but because different counties, as the hurricane worked its way through the state, stopped testing, the numbers of tests went down dramatically. And we can sort of turn to Donald Trump's favorite phrase here. If you don't test, you don't find cases. And that's true. The article saying, quote, after the state's testing sites closed Thursday evening, that's last Thursday, they won't reopen until at least Tuesday morning. That's yesterday. That's according to Candy Sims of the Florida Department of Health in Broward County. So what do we do? Well, one thing we can look at is ICU usage. And you can see that Florida ICU usage hit 100% in the last week of July, and it's still there. You can actually go over 100% in that you can start to convert non-ICU spaces in hospitals to temporary ICU. But Florida has been stuck at 100% ICU usage for days. This is very, very bad. And I'm getting more and more people saying, can we even trust the numbers now? Can we trust the case numbers? Can we even trust the death numbers right now? And this is a real concern. Now, part of the concern generally comes from the change that happened from July 15th into July 16th, where hospitals were mandated to stop reporting directly to the CDC and instead to the Department of Health and Human Services. There are open questions as to if and to what degree that has influenced numbers. In specific states, though, we know why the case numbers are going down. Florida is one example. They stopped testing because of the hurricane. Let's look at California. California now is admitting that for days they've been underreporting case numbers. The explanation is still not totally clear, and maybe by later today or tomorrow we will know more about it. But a message appeared on California's COVID-19 dashboard, which said, quote, due to the issues with the state's electronic laboratory system, these data represent an underreporting of actual positive cases. California's top health official, Dr. Mark Galley, said, quote, over the past few days, the state system, we've discovered some discrepancies. So we're still waiting on more information. But when you look at the national case numbers and you see that they seem to at least have stopped increasing, understand that two of the major case centers, Florida and California, are underreporting cases. One, because they have stopped testing because of a weather event. California, for some unknown reason that they've discovered discrepancies. And yet, even with Florida reducing testing, even with California underreporting, we still had 54,000 new cases yesterday. We still had almost 49,000 new cases on Monday. So a few different thoughts on this. Cases aren't really declining. They've kind of leveled off at the national level, but two states are underreporting, and that would be a huge piece of why that is. So first off, at this point, it's very hard to say for sure whether cases are still growing nationally or have leveled off or what's going on. What we do know is that the big picture, the sort of fundamentals of what's happening in the country haven't really changed. So we wouldn't really expect a huge decline because there haven't been any big changes in policy. Now, it's conceivable that even without states really changing policy, that people are seeing the headlines and they're being more cautious. That's possible. It would take about 15 or so days to notice that. And increasingly, deaths are going to be the indicator to the extent that we can trust them. And if you look at the trend line in terms of deaths, the 7-day moving average, which sort of smooths out those dips of reporting that happen over the weekend, the death rate and the death trends don't look good. They may have maybe leveled off slightly, but yesterday, again, we had nearly 1,500 deaths. So it's too early to say. And then you get to, are there ways to cover up deaths? We know that there are. You can mess with cause of death. You can do other things. So the important message, I think, is we're in an area now where there is a question mark around the accuracy of the data. We don't have to go conspiratorial. We don't have to make any definitive statements. We can just say there are reasons to be skeptical of the data, including that Florida stopped testing and California is underreporting. So we are still at huge risk of even bigger spikes. When the United States got from, 35,000 cases a day down to 20,000, almost every state started reopening. 20,000 cases we still had, and many states saw that as a license to open. And we got all the way back up to 70,000 cases a day at one point about 10 days ago. What we can say for sure is widespread reopening and ignoring risk factors and risky activities and not wearing masks is going to create a completely out of control spike. And just look at some of the headlines from the last 24 hours. Teachers returned to a Georgia school district last week. 260 employees have already gone home to quarantine. Not good. Dr. Fauci says if we don't get below 10,000 cases a day before the fall, we will have an even more insane explosion in the fall. And that's still 10,000 cases a day. That would mean we needed like an 80 to 90% reduction to get down to 10,000 cases a day. Clorox announces it will not have enough disinfecting wipes until 2021, according to its CEO. 25 people have been infected at a Bible camp in Oregon. When coronavirus subsided in Israel, Israel reopened schools. It didn't go well, and things are shutting back down. This is a real thing. You know, when Trump says it's the invisible enemy, it's this dumb thing he keeps repeating, the invisible scourge, nobody telling him it's pronounced scourge. Okay. But in a sense, it can feel as though it's not really there because it is invisible. We see the results through our actions. Our actions directly impact these numbers to the extent that we get the real numbers. And we need to be very cautious. I'm trying to take it in stride in the sense that I can only focus on my sphere of influence. I can't control what everybody in the country does. I can't control what the policy is. I can ensure that I'm acting as responsibly as possible. And at least to you, I communicate what seems to be responsible. Our actions have consequences. And if it's, I can't think of a time where it's been more clear than it is right now. I'm really excited that one of our sponsors today is Helix Sleep. I sleep on a Helix mattress at home. I absolutely love it. And that's why I reached out to them about sponsoring the David Pakman Show. Buying a mattress in the past was always a huge guessing game for me. I didn't know what I actually needed. I didn't know what I would like. But Helix has a sleep quiz on their website. You tell them your body type, your sleeping position, your back pain issues you might have, and their tool matched me with a mattress that is perfect for me. It's cool enough at night. It's the right firmness. I generally just do way better sleeping these days because of the mattress. Helix was awarded #1 best overall mattress for the last 2 years by both GQ and Wired Magazine. It is well-deserved, I can tell you firsthand. Every Helix mattress comes with a 10-year warranty. You can try the mattress risk-free for 100 nights, and they will even come pick it up at your house if you don't love it, but I know you will. All of my viewers will get up to $200 off your order, and you'll get 2 super premium pillows for free when you go to the link right underneath this video.